Hi, my name is Evelyn Mora, and my presentation is on external fixation devices, pin site care, and meds. The purpose is to stabilize complex fractures when internal fixation is impossible, maintain bone alignment while allowing soft tissue healing, provide access for wound care in open fractures. Assessment: inspect pin sites for redness, swelling, drainage, pain, or loosening. Monitor for systemic signs of infection, fever, elevated WBCs. Assess neurovascular status, color, temperature, sensation, movement, pulses. Evaluate pain level and effectiveness of interventions. Disease condition used in open fractures, comminuted fractures, limb strengthening, or corrective orthopedic procedures. High risk of pin site infection due to skin penetration, complications like osteomyelitis, loosening of pins, and impaired healing. Medications: analgesics, acetaminophen, NSAIDs, opioids for pain control, antibiotics, prophylactic or therapeutic if infection develops, topical antiseptics, chlorhexidine, povidone, iodine, or sterile saline for cleansing, NJux, stool softeners if opioids used, antiemetics if paid meds cause nausea. Interventions: perform daily pin site care using sterile technique. Clean each pin individually to prevent cross-contamination. Apply sterile dressing if ordered. Encourage mobility as tolerated to prevent complications such as DVT, stiffness. Collaborate with provider if signs of infection appear. Patient teaching: teach patient and family how to clean pin sites at home. Stress importance of hand hygiene before care. Instruct to report increased pain, drainage, fever, or loosening pins. Review medication regimen and adherence. Encourage balanced nutrition for bone healing. Documentation: record pin site appearance, drainage, odor, pain level, interventions performed, and patient response. Note medications given and effectiveness. Document patient and family teaching and understanding. Include neurovascular checks and mobility status. Step-by-step explanation on how to clean the site. 1. Preparation: gather necessary supplies, sterile water, sterile gauze, cotton swabs, and waste disposal. Wash your hands thoroughly before starting the cleaning process to minimize the risk of infection. 2. Cleaning the pin sites. Gently massage the skin around the pins to help bring any drainage to the surface for cleaning. Use sterile water or saline to clean the area around each pin. Clean away from pin to prevent transferring bacteria into the pin site. Use a new sterile cotton swab for each pin to avoid cross-contamination. 3. Dressing the pin sites. After cleaning, apply a sterile dressing to each pin site. Dressing should be changed regularly, typically every 5 to 7 days or more frequently if the skin site appears irritated or infected. Monitor the dressing for saturation and change it as needed to keep the area dry. 4. Monitoring for infection. Regularly check pin sites for signs of infection such as redness, swelling, increased pain, or discharge. If any of these symptoms occur, contact your healthcare provider immediately. Pin sites should look like normal piercings with no excessive redness or drainage. Avoid soaking the pin sites in water, example given, baths, until cleared by your healthcare provider, as this can introduce bacteria. And that's it. Thank you.